Hello all, we will start with a very important next topic, that is direction of trauma, and one very important topic, that is CSF Rhinorrhea. So, this diary goes back when this topic of direction of trauma in fact came in my NEET-PG examination itself. So what actually is this direction of trauma? See, try to understand this particular thing. Trauma that is happening, in the nose can be either a trauma from the front. Fine. If we are supposedly boxing, we will, give a trauma to the nose. How? Either we will punch from the front or we'll give a upper jab, trauma which is from the below. Trauma can either be from the front or trauma can either be from below. So trauma from front and trauma from below are basically called by different names. So what happens is, most of the students who appear for what your NEET-PG, INI-CET or FMGE, any sort of examinations, they most of the time know that if direction of trauma question comes, we know that there is something called as chevalet and something called as Jajave fracture. But most of the time, whenever we land up in the examination hall, most of the time we forget, okay, chevalet was for frontal or chevalet was from trauma from the below. So one fine mnemonic that I'll teach you all is, you remember there have been one, United States President, that is John F. Kennedy, JFK, John F. Kennedy. So I, use this particular mnemonic to, remember chevalet and Jajave. So John F. Kennedy, JFK, Jajave is trauma from the front. If we remember it, Jajave is trauma from the front, then obviously chevalet is trauma from below. As simple as that. John F. Kennedy, JFK, Jajave is trauma from the front and chevalet is trauma from below. So if I talk about chevalet, it is basically one C letter, chevalet. So chevalet is trauma from what? Trauma from below. So if there is trauma from below, that means it will lead to a vertical fracture. Trauma from below will lead to a vertical fracture. Yes, sir. And Jajave is trauma from the front. If there is trauma from the front, that means it will go horizontally and it will lead to a horizontal fracture. So you have to remember these two very important names, that is chevalet, trauma is from below, and if there is trauma from below, it will lead to a vertical fracture, and Jajave is trauma from the front. If it is from the front, it will lead to a horizontal fracture, and the simple mnemonic is John F. Kennedy, JFK, Jajave is from front. If Jajave is from front, that means chevalet is obviously from below. Apart from that, trauma to the nose can be multidirectional, but mostly this sort of classification you don't have to write, in that examination paper. You just have to mark the MCQ part. For that, you have to remember chevalet and Jajave mainly. Fine. Going ahead, I will start with a very important new topic, that is CSF Rhinorrhea. See, let us break this word first of all to understand what is CSF Rhinorrhea. So, rhea means basically discharge. Rhino means nose. Obviously, yes, rhino means nose. And then CSF, cerebrospinal fluid. So, CSF coming out as discharge from the nose is CSF Rhinorrhea, as simple as that. CSF coming from ear, it will be CSF otorrhea. Oto means ear, rhea means discharge. CSF otorrhea will be CSF coming from the ear, and CSF coming from the nose is CSF Rhinorrhea. So CSF coming out as discharge from the nose is CSF Rhinorrhea. In fact, you should remember, all of you, whether you are an undergraduate, third year MBBS or whatever MBBS student, or you are appearing for your postgraduate examinations, remember that the only watery discharge from nose cause that you should remember for watery discharge from nose is the cause CSF Rhinorrhea. Most of the time examiners used to add, where you will see mucoid type of discharge, where you will see mucopurulent type of discharge. Similarly, if they ask watery type of discharge from nose, it is CSF Rhinorrhea. Similarly, watery type of discharge from ear is CSF otorrhea. Remember these things. So watery discharge from nose, what is the cause? It is CSF rhinorrhea. That is the only cause that you should remember. You should know at an undergraduate point of view. Fine. Then coming to CSF rhinorrhea particularly, what is the most important main cause of CSF rhinorrhea? So remember guys, trauma is the most important cause, the main cause. In fact, we say in our books also 90% of the CSF rhinorrhea is because of trauma. Trauma, chot lagna, that is trauma. Trauma is the most important cause of CSF rhinorrhea. And exactly where is the trauma? Obviously, if this is the face, try to understand this thing. So, trauma to this region, this is what? Your cribriform plate. So, trauma to cribriform plate. Remember, trauma here. This is what? Cribriform plate. Yes. So, trauma to the cribriform plate. And if I specify the location, it is basically fovea ethmoidalis. So, 90% of the CSF rhinorrhea occurs because of trauma. Where exactly? At the fovea ethmoidalis part. Basically, it's a part of the cribriform plate. So, this is the location where a trauma occurs and it will lead to CSF rhinorrhea. Fine. Then you might be thinking, sir, there are various type of traumas, like there may be accidental trauma, homicidal trauma, by chance suicidal trauma, iatrogenic, maybe the doctor has done it, So what is the exact trauma? Can you specify? Yes, sir, we'll specify it. It is iatrogenic trauma. Remember, mostly we doctors ourselves, while doing surgery, surgical procedures inside nose, do this particular trauma to the cribriform plate and it leads to CSF rhinorrhea. You'll be amazed to know it's the iatrogenic trauma, done by the doctors itself. We itself do it most of the times whenever we are doing different types of nasal surgeries. So, iatrogenic trauma is the most common cause of CSF rhinorrhea. We tend to say to our postgraduates also that 90% of the CSF rhinorrhea is because of trauma. And of those 90%, 90% it is because of iatrogenic trauma, because of the surgeries that we are performing. Fine. Non-traumatic CSF rhinorrhea are very rare. Like they will be seen in cases of increased intracranial tension. So very rare, most of the times we don't even see such cases of non-traumatic CSF rhinorrhea. Mostly we will see traumatic CSF rhinorrhea. Fine. Now comes the differentiating point. I told you that non-traumatic CSF rhinorrhea very less commonly seen, very rarely asked. Most common cause is the intracranial tension increase in case of non-traumatic CSF rhinorrhea. So I won't focus also in non-traumatic CSF rhinorrhea because it is very rarely asked, rarely seen also. Fine. There is a sort of a single ring sign, single halo sign seen in non-traumatic CSF rhinorrhea, but we won't be focusing on that non-traumatic part that much. The important part is, please try to understand, the important part is traumatic CSF rhinorrhea. In traumatic CSF rhinorrhea, don't you think because of trauma, CSF will come out fine, but because of the trauma, blood will also come out along with the CSF. Because trauma has happened, na? Because of trauma, CSF though will come out, but along with that, blood will also come out. And whenever that blood along with CSF come out, and you take that type of discharge, maybe on a filter paper, any sort of a paper, you will see such sort of sign. And what is this sign called as? It is called as double halo sign. It is also called as target sign. It is called as the double halo sign. It is also called as the target sign. Very important, also called as the target sign. Why it is called as double halo? See, if I magnify this image, can you see alternative rings between the blood margins and the CSF? Because of these alternative rings of the blood margins and the CSF, it is called as double halo sign or the target sign. Sir, trauma to the cribriform plate, fovea ethmoidalis has occurred. CSF rhinorrhea is happening. And if you see patients of CSF rhinorrhea, believe me, what happens is, whenever you ask the patient to do like this, just flex the neck, then what will happen? That CSF will come out dripping like this, tuck, 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 tuck. It will be continuously falling like a water droplet, continuously falling, tuck, 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 tuck. If you just ask to flex the neck, fine. that much pressure, because of the CSF pressure, it is falling down. Tuck, 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 tuck. Sir, if I try to sniff back any normal nasal discharge of rhinitis and chronic sinusitis, whenever we have any sort of nasal discharge, you must have felt that whenever that nose discharge is coming out, you try to sniff it back and it goes upwards. But here, in case of CSF rhinorrhea, whenever you do like this and you try to sniff back that CSF rhinorrhea discharge upwards, it won't sniff back. It will be continuously falling down. Tuck, 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 tuck. This is a very important differentiating feature of a CSF rhinorrhea and the rhinitis and sinusitis. So, continuing to the other parts, sir, can you differentiate between a CSF rhinorrhea with sinusitis? Yes, sir, I can definitely differentiate. What is the cause of CSF rhinorrhea? You will say trauma. What is the cause of sinusitis? You must say, sir, infections, different sort of infections. Maybe the infections, sustaining or pertaining for a very long time. What is the type of discharge? Type of discharge here in CSF rhinorrhea is watery. I told you, we have already discussed these points. Watery type of discharge. In case of sinusitis, sir, what is the type of discharge that I will, see or appreciate? It is more commonly mucoid type of discharge, less commonly mucopurulent also. Then, sir, on sniffing, will it sniff back CSF rhinorrhea? No, absolutely no, sir. It won't sniff back. But in sinusitis, you must have felt whenever you sniff it back, it gets sniffed back. And lastly, glucose. Glucose is present in CSF rhinorrhea. Why? Because CSF has a concentration close to plasma. So, glucose present in that discharge, which is coming along with that, in fact, with the trauma of the cribriform plate. Basically, CSF rhinorrhea will have that glucose thing. But in case of sinusitis, absolutely not. Absolutely not, obviously. Otherwise, you would have been eating or drinking your discharge itself. Anyways, better to take the energy from the discharge of sinusitis if that would have been happening. So, absolutely no, glucose is not present in the sinusitis discharge and is present in CSF rhinorrhea. Fine. Going to the next part. Sir, what shall be the methodology to diagnose CSF rhinorrhea? Dekho, try to understand one very important thing. To diagnose, to see CSF rhinorrhea, I have number of investigations. I can go for CT scan, I can go for MRI, I can go for the target or halo sign, I can go for cysternographies, all sorts of investigation I can do. But remember, the most important investigation of choice, gold standard, best method, all sorts of methods, the finest investigation methodology is always and always beta 2 transferrin test. Very repeatedly asked question. It is a beta 2 transferrin test, that is the gold standard, or you may say best test, or you may say best method, you will say investigation of choice. It is always and always what? Beta 2 transferrin test. Apart from that, I told you, you can go for CT, MRI, you can go for cysternographies or any sort of investigation. But the most important test is beta 2 transferrin test. Sir, congratulations that you have diagnosed that it is a case of CSF rhinorrhea. How will you treat it, sir? See, most of the times the management of CSF rhinorrhea is conservative. Remember, management of CSF rhinorrhea, particularly if I talk about the treatment of CSF rhinorrhea, is very important, conservative. Sir, what do you mean by conservative? See, what happens is, most of the times whenever we encounter a patient of CSF rhinorrhea, what happens is, I know that the patient is basically having all sorts of problems. But I know that most of the time that opening that has been created because of the trauma will close by itself. But what I have to manage is ask the patient to just relax, little bit head elevated. Relax, lie down in the supine position with little bit head elevated. Apart from that, I will start with double dose of antibiotics. Mostly. Antibiotics, that is in fact double dose. Why I do double dose? Because I don't want any sort of nasal infection goes into the CSF. So double dosage of antibiotics, ask the patient to relax, lie down in supine position with head end elevated. Apart from that, I will ask the patient to not sneeze or cough. If the patient sneezes or coughs, mostly the pressure will be increased here and CSF rhinorrhea may start happening again. Fine. Mostly the treatment is conservative. Rarely we go for a surgical management of the CSF rhinorrhea. And basically the surgical management for CSF rhinorrhea is, covering that area with flaps. Very less commonly asked are these flaps, like there are something called as Haddad flap or reverse Haddad flap. These are used for covering that CSF rhinorrhea part, but mostly what you have to remember is that the management is conservative. I hope you got this particular point of CSF rhinorrhea.